familiar faces today, but for those of you who don't know, this is Scientific Literature Society. We meet once a week to discuss breakthroughs in science, and this week we have Dr. Kevin Peterson here to indulge us in some of his knowledge about medical school. So I hope you guys came prepared with questions, and you guys can go ahead.
Thank you. So hi everyone, my name is Kevin Peterson. I'm super excited to be here today with you. So today's session, I just wanted to give a brief overview. I didn't really prepare anything formal. I'm just going to talk about my journey in medicine, my journey through undergrad and medical school and my master's program, and now going to residency in a few months in OBGYN. And just, I really want most of this to be more of like a Q&A about what questions I can answer for you guys, more about like what questions you have that you might not want to feel comfortable asking other people about medical school or dental school or really anything. They're all same caliber, so whatever questions that I can help answer to make you guys feel more comfortable, that's my goal today. So I'm just going to talk like maybe 10-15 minutes just about my journey, and then we'll open it up for questions and just discussion, okay? So like he said, my name is Kevin Peterson. So technically I'm not a doctor yet. I have 3 weeks before I graduate, but I completed all my requirements. So soon to be Dr. Peterson. And I also got my master's in public health during medical school between my 3rd and 4th year. So why I'm here today, Dr. Shandbag, I used to be my Orgo professor, and I used to be president of this club when I was here at Nova. And I think it's really important to share our stories, because I think medicine, when people kind of think of it, we all hear of those students that have, and it's totally fine if you are that student that have doctor parents and wanted to be a doctor since they were a child and like all of that, and I was none of that. I was completely not medicine focused. I almost didn't even graduate high school, and I was on the road to be a professional dancer. I wanted to be a dancer my whole life. So that all changed very quickly, and that I turned into medicine. But so basically I was in high school and I wanted to be a dancer. I was not the best student. I skipped school a lot for like dance competitions and stuff like that, and I just like wasn't a great student. And so I actually graduated maybe with like a 2 point something. I almost didn't graduate. I wasn't allowed to go to prom because I missed so much school. Like, was not a very academically focused person. And when I applied to college, I got denied from every public college in Florida, and I actually had to start at Broward College, community college, because that was the only place I got in. So going into school, I was like, what do I want to do with my life? What am I interested in? And when I was thinking about school, I was like, okay, science was like my favorite subject if I had to pick one. And I really just thought like, I like people, so you know what, nursing might be what I want to do. So I enrolled in like the pre-nursing program, and that first semester in community college, I was like, wow, I really like this material. Like, it was actually the first time I was like really excited about school. And so I kind of did my first semester, and I was like, wow, I really like that. I did really well. It was the first time I like was studying outside of school ever in my entire life. I was like, I would go home and like open my notes, and my mom was like, what are you doing? Like, what is going on right now? So that's where I got interested in medicine. And then my second semester, I took like Anatomy 1, and I just like really, really loved it. And I really like had this like thirst for knowledge and like deeper understanding. So you know what? I was like, I talked to one of my professors. Well, no, first I talked to one of my guidance counselors. They're like, yeah, like community college doesn't really set you up for medical school. You'd have to transfer to a 4-year university. And I didn't know any of this stuff because I don't have anybody in medicine in my family. So I basically was kind of just fumbling around trying to do it. But my anatomy professor was like, you know what? She went to actually medical school. And she was like, you know what? Like, if you need some advice or anything, I'd love to meet with you and talk about it. So she kind of talked me through the process. You need a 4-year degree, you need these prereqs, you need to take the Mcat, and this was the first time I heard of it, and I was like, you know what, that sounds easy enough, like, let's do it. Obviously it was not easy, but I transferred to Nova here for my 2nd through 4th year of undergraduate, and I got my degree in biology. And while I was here, I was in the dual enrollment program, and I was just really excited to be at a 4-year university because I was only known public high school and community college, and I really focused on like really understanding the material, and I was really curious about the material. And a lot of people ask me kind of just like, what you need to do to like prepare for the MCAT, like what resources did you use? And honestly, when I think back upon it, I think the biggest asset for me for doing well on the MCAT was actually being interested in the stuff that was being taught in class, and actually learning the material in the class is really what prepares you for the MCAT. I mean, like you can take these MCAT prep courses, and I did like a self exam crackers or whatever people use nowadays. I did do that, but most of the material, like that's what undergrad's for. It's really just for the MCAT at that point. If you're pre-dental, the dental entrance exam. So yeah, that was my undergrad experience. I was president of this club for 2 years, and I really enjoyed that. And during undergrad, I did research with Dr. Uma Kandalam. I don't believe she's here anymore. She just moved, I think, 2 months ago. But I did stem cell research over at the dental school, and even though I was pre-med, pre-dental, it doesn't really matter. It was research that I was interested in, and we were doing stem cell research on gingival stem cell regeneration, and it was something I was interested in, and it really just opened up the world to research for me, because with no academic background, I was like, what? Like research, yeah, like you hear about it. I didn't know what it was, but that was really what opened the scientific world up for me, was that. So basically, I started getting a lot of exposure with presenting at research conferences. I presented at the World Stem Cell Summit with that research, and I just really got interested in it. So then after that, I applied to medical school, and I got into the University of Central Florida, where I am currently a medical student at. And I just really, really loved it. And I want to answer questions after this about what your questions are about medical school or anything like that. So I'm not going to talk too much about medical school. But while I was there, I did 2 main research projects. I did a research project on the anesthetic solutions for local anesthesia. And then I also did cardiovascular research on congenital heart deformities. And I was also elected as the president for the first 3 years of medical school. And so for those of you that don't know, most medical schools, you have 2 years of preclinical years. So you do mostly what you're doing now, your classes, your sciences, your basic sciences. And then your 3rd and 4th year are all in the hospital. You're done with being in the classroom, which is what everybody wants to be at, right? Like that's the fun part of medical school. And so when I got into the wards, which is what it's called on the 3rd and 4th year, my 3rd year, I had to start thinking about what kind of doctor I wanted to be. And for me, I went into medical school thinking the last thing I wanted to do was be an OBGYN. I was like, I don't have those parts, I'm not interested in those parts, like that is not something that I felt really passionate about, like I didn't. But you know, I think for me, I've always been very, very like women empowerment. It's like that's always been a part of me. My mom raised me basically by herself, and that was a big part of my upbringing, was being part of women with strong women leadership. And when I went to my rounds, I just loved everything about OBGYN. Like I loved that you can be a surgeon, you're a surgeon, you do clinic visits, you do health maintenance, you do preventative medicine, you do everything. You really are the primary caregiver for women and women's health. And it's not just delivering babies, it's doing hysterectomies, doing surgery, cancer surgery, chemotherapy, all of that stuff falls under OBGYN and women's health. And specifically what I'm interested in is gynecology oncology, which is women's surgery and chemotherapy for ovarian cancer and different women's cancers. And that's where I would like to go after my OBGYN residency, because that's a fellowship after. So I was in my 3rd year and I was thinking, okay, like I really love this, and I kind of started noticing things. We worked at very underfunded and underserved communities, hospitals, and I saw different things that were impacting my patients' health and that access to health and things like that. And I was thinking, what can I do to kind of get more knowledge about this? So during my 3rd year of medical school, once I decided I wanted to be an OBGYN, I applied for master's programs in public health across the US. And eventually I got into Harvard for a master's in public health and social behavior, and I did a focus on women, gender, and health. So basically what my field of study is seeing how social disparities and how these different things affect women's health and what we can do and what interventions we can do to stop it. And during that, my dissertation or my term paper was on racial mortality amongst maternal mortality, and what the things are that contribute to that, like systemic racism and different implicit bias and those things. So that was my main focus while I was at Harvard. And also, when you're there, you have to do a practicum, and I was also the LGBT and sexual health advisor for the International Association of Providers of AIDS Care, where I worked on 2 global studies on doing sexual education amongst gender minorities all across the world, and then HIV prophylaxis across the world. So those were 2 big studies that I was involved in there. So after graduating, this is where I am now, basically in my 4th year. I'm 3 weeks away from graduating, and I completed all my rotations, and I focused. So your 4th year, you focus your schedule towards what you're gonna do. So I did lots of rotations in OBGYN, and this year is when you start applying for residency programs and you start interviewing, and I'd love to go over that process with anybody that has questions about that, because that's something that, again, I didn't have any idea of when I was going to medical school. I thought you just go to medical school and you're like, oh, like I can pick what doctor you want to be, and that's not exactly how it works. It is, but it's not. And I'd love to talk about that if you guys are interested. But I just recently got accepted into Stanford for OBGYN residency, so I'll be moving there in 3 weeks. So I'm super excited for that. And that is my background. I feel like that was a long-winded explanation of my background. I just didn't want to take up too much time talking about me. I really wanted to be here to answer your guys' questions and see what questions you guys have about Mcat, entrance exams, medical school, residency, all of that. All of those things are what I want to answer for you, because I was sitting in your very position like 6 years ago, like right here in this room. It was still in this room. Dr. Shamdag was sitting at that chair at that corner, and I was literally sitting here. And now I'm going to be a doctor in 3 weeks, pursuing my dreams. So I just wanted to be here and show you all that you guys can also be where I am, or wherever you want to be, and far beyond where I am, from sitting in this chair today.
Kevin, is research a common thing at UCF, or is it required?
Yeah, so
at UCF?
Yeah, so
not all med schools require
So
it.
not all medical schools require it. Most have shifted to including some sort of research program. At UCF, there is a requirement that by the end of your 2nd year, you finish and present a research program. It's the Focused Inquiry in Research Exploration Program, I believe. It's called FIRE. Most medical schools have shifted towards some sort of required research, just because it really is an important part of most doctors' practice, especially with, even if it's not research that you're going to be conducting, being able to read a research paper, hopefully this club is helping you do, being able to dissect a research paper, being able to know what the statistics mean and how those impact care are really important things, and you learn those through actually doing the research. Yeah.
How was that built into your preclinical years, your curriculum, or, okay.
So yeah, at UCF, I can only speak to UCF because that's the only one that I'm familiar with. But you, at the beginning of your 1st year, there's like a big research fair, and like all these mentors come, or you can find research your own. You can cold email people, which is something that I did too. And you just say basically, hey, like I need to do a research project. Most people at academic institutions do research, so it was pretty easy. And then they guide you. You have classes on statistics and like how to do things, and you get money to do this research. And basically, you'll be guided on how to do it, and then eventually present your research at the UCF conference. But you're really encouraged to present outside as well. Yeah.
Would you be able to explain the match process as well as residency and how like Stanford and all of that, and how the whole process happens?
Absolutely. So this is something that I was completely blindsided by when I got to medical school, because I guess I didn't do my research well enough. But so basically once you're in your 3rd year, you kind of start deciding basically what you want to do, what kind of specialty you want to go into. And I believe dental school actually also has a match process, because my friend Maya also did basically the same thing. And basically what you do is
Where is Maya?
Maya is now at Albert Einstein doing pediatric dentistry residency right now. She's almost done, which is awesome. But she was vice president of this club and sitting in the chair next to me. So, and she did dental school. I did medical school. But so basically, you fill out an application just like medical school, the exact same thing. It basically looks the same too. All the sections where you put your interests, your clubs, all those things. And then your scores, your step 1 score, which is now pass fail, so that's one less thing to worry about. But your step 2 score is now going to be considered, I believe. There's still like a little debate on how that's going to work. Your grades, everything, but the biggest thing is your comments from your preceptors, from your rotations. Like those grades and those comments mean a lot. They have a lot of weight. And then you make a personal statement. You do all of that, and then you send them out to everywhere you want to apply to, and you can apply to 1 specialty, you can apply to 2 it doesn't matter how many specialties you want to. Usually you're do 1 and then maybe 2 if you're not too sure if you're competitive enough for that one. And then basically you are invited to interviews for certain ones that want to interview you.
Wait. How are you going to show passion to 2?
So you can
You
change.
gotta lie.
Yeah, you can change your personal statement. You can change your personal statement, so you can have 2 different ones.
Because both of them have to be passionate.
Yeah.
Passion that sells.
Yeah. So there are ways you can do it. Most people apply to 1 specialty. That's and your advisors will kind of tell you where you fall into. There's certain ways to see how competitive you are for certain specialties. So after that, after you interview, you make a list 1 through however many you interviewed at. They make a list of who they want from 1 to whatever in ranking in preference, and then a computer system basically matches you. So like for example, if I put Stanford's per se number 1 and they had me in their they have 6 spots for OBGYN. So they have me somewhere in the top 6, I automatically am gonna go there. But for example, if I have Stanford number 1 and then let's just say UCF number 2, but Stanford doesn't have me in those top 6, and then like those top 6 spots are filled, then I'll probably get UCF if I'm in their top 6, and it just keeps going into like a matching process. But then if someone if their number 1 choice didn't rank them, then I could potentially move into their top 6. So it's like a huge algorithm and match process that works.
What if you don't match?
So that is a good question. So there is a possibility of not matching. The national, I believe the rate this year was 90-something%, 93 or 94%, I believe.
It looks like it's a big number. It's a bad number.
So there's like a 4% chance, 4 to 5 to 6, depending on, I don't remember what the exact thing. You can not match, and you can do. So if you don't match, you can then do the scramble, or it's called the SOAP, Supplementary Offer Acceptance Program. And during the week, you will get different interviews. You can apply to like just all the unfilled spots, because programs can also not match people, and they want to fill their programs. So then you just do all that process, and then you can find out on Friday if you matched or not. But if you don't match, you can take a research year. Certain states you can work under a provisionary license, because you need to have 1 year of internship to be a fully licensed doctor. But after that, then you're a fully licensed doctor. So there is a possibility of not matching. It's pretty rare, generally speaking, especially if you're taking the advice. A lot of people that don't match, or for example, you're passionate about orthopedic surgery. Orthopedic surgery is one of the most difficult specialties to get into. And let's just say you didn't do well on your exams, you didn't do as well on medical school as you would have liked to. It doesn't mean you can't match there, but your probability isn't going to be as good, and then you could probably go unmatched if you, those are most of the cases. And then there's also a difference between matching into certain specialties from MD, DO, foreign MD programs, and then foreign graduates. There's different statistics there as well, which I don't necessarily agree with, but that's unfortunately how the match processes works today, because now MD and DO residencies have merged, so they're available for both. Yeah.
How early did you start considering, context, I'm post Mcat pre-applying.
Yes.
So this is a really fun, nerve-wracking time. How early did you start considering, I guess, factor, well, right now I'm just trying to get in, but like, how early do you start considering like, I guess like school ranking as far as specialties and things like that,
Yeah.
like competitiveness, like, okay, like, you know, Baylor is really great for primary care, family practice, but then
Yeah.
you end up in OBGYN when you never thought about OBGYN, so like,
Yeah.
how early did that start?
So that's actually a really good question, and I think that's good that you're thinking about that now. Fingers crossed, good luck on you on your Mcat. So basically for me, I think it is important to look at the school's mission, and they usually have, most schools, if not now or during your interview process, will give you a match list. Not usually with names, but it'll have like the past few years of how many people match into which specialties. And that kind of gives you a sense of where people kind of match, what programs people match in. And that's a good thing to look at and consider. But also that doesn't necessarily also mean anything, because for example, historically at my school, only one or two people applied to OBGYN at all. This year, 6 of us applied, so which is like a medium number. So everything, there's so many variables that go into it. I would say that cost is a big thing to consider in medical school. And if you are truly going for specialties, a specialty that you really want to, just weigh the cost-benefit analysis. If you get scholarships somewhere versus not, I got a scholarship for UCF, and that helped my decision by picking there, because you're going to be upwards of, depending on your financial situation, upwards of $200,000 in debt, and paying that off is not fun. Except, yeah, it's not fun. I just had my exit counseling meeting with my loans. It was not fun. But yeah, so I would say go to a good reputation program for the specialties that you're going into, and you can do that by asking current students. I think it's too early to look into that now, unless you're looking at where to apply, but I assume you're applying to like a lot of places.
Yeah.
So once you get your interviews, I think those are good questions to ask current students, current faculty, administration, like where do people end up matching, what specialties do people match into? Well, match rate is a really good question as well. And those are things that I would start looking into once you start interviewing.
Taking notes.
Do medical schools emphasize primary, like when you're going in for interviews, would you say that it's important to say that if you want to do primary care and along those lines, rather than like a more difficult residency to get into?
So I think that also very much depends on the school, and I think this is where it makes a lot of sense. Before each of your interviews, you're going to research that school. You're going to look at their mission. You're going to look at where they match. Like a lot of schools do have primary care focused tracks now. Like some schools actually have like rural primary care as like a track that you can apply to. So for most programs, like it doesn't really matter. And to be completely honest, unless you have like a set thing in your mind and you know you want to do primary care because you come from this underserved community and you see yourself doing that, you're gonna change your mind. When I think 99% of people that I was friends with changed their mind during medical school of what they wanted to be. So I don't think they put too much weight into that unless you're applying for those specific roles. But for example, there are schools that their mission is to produce family medicine and primary care doctors, and a lot of their match list will kind of like be emphasized with that, and they'll probably want to think of people more in that mindset of wanting to do that. But I think in general for medical schools, I don't think it's that important. And a lot of I didn't get asked too many times like what specialty I was thinking. Sometimes they would just kind of be like, oh, like what are you interested in? Just because like they know it's truly gonna change probably over medical school, because what you think medicine is now is completely different from what it is in practice.
And 3 years in med school, you will be transformed into a different robot.
Yes, yes. In medical school, it changes a lot. I think it would change. I would say it changed a lot about how I look at the world and how I operate in the world, because there's just so many different things and difficulties that you go through in medical school, and everybody's medical school experience is different and in a non-linear way. But yeah, there's different experiences that will make you want to go into certain specialties, and certain experiences that will make you want to do primary care, and if that's what you're passionate about. And there's just so many things, but a lot of people kind of usually start with the question, do I want to be a surgeon or do I want to be like a medical practitioner? That's kind of the first big question you ask yourself when you're in medical school, when you're going through your things, because usually there's surgery residencies. OBGYN is ironically the only one that's actually very, very, very much both. They're one of the only specialties that do a lot of primary care, a lot of surgery. So, and then you can go into different fields. Like there are five fellowships that you can do after OBGYN that are board certified. Gynecology, oncology, which is mostly surgery and chemotherapy. You can do maternal fetal medicine, which is high risk deliveries. You can do REI, which is reproductive endocrinology, and infertility, which is like helping people get pregnant. Complex family planning, so like abortion providers and complex medical management of birth control. And I believe there's another one. And you can do hospitalist. There's so many different things you can do in OBGYN, which is honestly why I love it so much. There's so much you can do with it, and the patients are amazing.
So after 2 years, you think you might be a different person again?
Oh, for fellowship? Yeah. So I think in residency, like I very much see myself liking gynecology, oncology. I did 2 away rotations at different hospitals in that, just rotating through that specialty alone, and I loved it. Do I think during residency I could definitely change my mind, and I'm keeping an open mind to see what I want to do in the end.
Not to change from OBGYN. Even within OBGYN, you may have certain illusionary view of doing this, but once you go there, you start going, okay, that's something.
Yeah, absolutely. I think the thing is you can never really picture your life in something until you're in it, and that's a big thing that I think medical school oftentimes is very romanticized. Like you see like these people on TikTok and Instagram with their like color-coded binders and they're like doing these studying. That is not medical school. I don't care who you are, where you're going. That is not what your life is gonna look like. You're gonna be in the library with 10,000 books, or now just one laptop, whatever, a tablet, but you're gonna be sitting there crying. Just kidding, but like but that's me. Yeah.
I'm so sorry for all the questions.
No, that's why I'm here.
For the rotations that you said you did away, do you have to apply to those in your 3rd year, or do you do that in your 4th, like concurrent with your 4th year?
So at the end of your 3rd year, you start applying for away rotations. So your 3rd year usually is completely set up for you through medical school. It's usually through a lottery system where you do, but everybody has to pass certain standardized checkpoints. So you rotate in family medicine, internal medicine, OBGYN, neurology, surgery, psychiatry. You have to do all of those core rotations and pass the standardized exams to graduate medical school. So then your 4th year is when you start playing around with your own schedule. You can do all of your rotations at home rotations. The benefit of doing away rotations is, for example, if you have specific interests in OBGYN, but you want to go to a different hospital, or it's not in your area, or you want to get letters of recommendation. Those are huge for applications. So that's when you start like applying. They're called away rotations, and you just do that at different hospitals, which is also a really great way to see what other hospitals operate like, because sometimes your home institution is not like other places.
How did you integrate
No, go for it. Go for it.
How did you integrate the Harvard master's program in between that?
So I took a year off completely between my 3rd year. So the most common place where people do advanced degrees, so MBA, MPH, research year, anything like that, is between your 3rd and 4th year, because there's kind of a natural break. So after your 3rd year, you technically completed all of your medical school requirements for your home school. So then I took my step 2, so there's board exams you have to take, like the Mcat, but way different, not worse, different, but there's 2 of those.
You can't go for matching or anything if you don't pass your boards.
So yes, you need to pass your step 2, step 1 and step 2 in order to apply, or in order to be considered for a residency, correct.
So that's a bar that you have to cross.
Yeah.
Then you think about next.
Correct. And so I did my master's. They're usually accelerated programs for medical students, so I did mine in 1 year.
Wow. And is that common?
So I would say there's usually 5, in my school there's usually 3 to 5 people that do it every year out of a class of 120.
50? Okay.
Yeah, I think it really depends on your interests and your what you're passionate about. If that's something you like, not everybody needs to do it. For me, I saw it as a really great opportunity for me to learn more about this topic. And honestly, I think a big part of it also for me, not being a woman, going into OBGYN, it gave me a year to study a lot of things that maybe I wouldn't be as well versed in. So I took classes in maternal health care, mental health care. I took classes in maternal morbidity and statistics, and just things that helped me understand the woman experience more than I could have really known before. Not saying that that's necessary for every guy that's going into OBGYN, but I think it did give me a robust view of maternal health care. And I think it was something that I'm so happy that I did. And I had really great experiences at Harvard. Yeah.
Yeah, so I was actually going to ask that, but also what was that application process like to graduate school? Because I'm planning on doing that soon.
Yeah.
And what do you think made you stand out? Because I mean, going to Harvard is no small feat. So.
Yeah. So I think for me, I think it's different. I think you take the GRE, I believe, if you're coming from undergrad. They took my Mcat scores as my GRE entrance exam. But I think for me, it's honestly, so I'm gonna say this completely for every application, whether that's for medical school, residency, anything you do. Admissions committees know when you're doing something to pad your CV. You need to be passionate about the things you do in your free time. And it doesn't have to be 1,000 things. It can be 2 or 3 big things that are really important to you, because those really come across in your interviews and on your application. And you can tell when you're reading somebody's application what they're passionate about. And for me, it was LGBT healthcare. That's something that I'm very passionate about. And maternal mortality and health equity is something that I did a lot of stuff in. And as like medical school president, I set up lots of like social equity and justice events. Like we did like a White Coats for Black Lives ceremony. We did like a lot of different things that that were just near and dear to my heart, and just that I think helped me stand out. I can't really say what was on my application that they really loved, but I think it was just I showed a lot of passion for the subjects that I wanted to learn. So like I'm going into maternal, like I did my health and social disparities courses, so like they knew that I was going to apply this to my future practice as an OBGYN. So they like to see, I would say they like to see passion about the things that you're going to be learning and what you're going to be doing and how their program fits into helping your mission better the world. That's basically what I would say for every application. That's what you really need to focus on.
And follow-up, would you say that that was best conveyed in your personal statement, like maybe for even like DAT or?
Yeah. I think your personal statement is very, very. I think you're gonna get very, very different answers from everybody. Some people are gonna say make it very professional and to the point. Some people are gonna say make it more emotional and effective. And I think for me, the approach that I took that's worked well for me in my story has always really been like the saying that people are gonna remember how you make them feel and not the words that you say. And I think for me, a lot of that, like for my admissions essay for UCF for medical school, I straight up was like, like one of the sentences was like something like, medical schools like preach like wanting to show, to accept like represented minorities and underrepresented people. And I was like, but they're not accepting people from community colleges, and like that seems wrong. And I started at a community college. I don't have a pedigree of all these degrees. And like I don't have that background, so like I think that I'd be a good qualified candidate because I'm passionate about this and I want to do something with it. So like that was just something emotional from me. Maybe don't be that abrasive, but like just talking about your story. We want to know who you are as a person. Like what makes you, what fills your cup at the end of the day. What adversity have you overcome? But make it sincere. Don't over dramatize it, because then we also like. Yeah.
I think admission counselors are familiar with dramas.
Yes. Yeah. So I think it needs to be sincere, but it can be emotional if there's things that have happened. But you also don't have to have a sob story. That's also not something they're looking for. Yeah. Like you could say like my OBGYN application actually was a lot about I was a dancer for most of my life, and how all those lessons are going to make me a great OBGYN resident. For example, in dance, we have to be very aware of our body. During surgery, you have to be very aware of where you are spatially. And being able to take constructive feedback verbally and incorporating that into action is super important for surgery. If a surgeon tells you, don't do that again, like do it like this, you're gonna do it in real time. And that's how dance is. If you're gonna, I did ballet, and if you did something wrong and the ballet teacher told you, change it, they're gonna throw a chair at you if you don't do it the next time the right way. So that was just something that, see how it wasn't a sob story, but it was something that I used in my past to bring what I bring to the table now.
A lot of people write, oh, my grandpa was sick, so I saw the pain, so I want to be a doctor. No, not
Yeah.
everyone grandpa's sick grandpas deserve to be doctors.
Yeah.
Yeah, you have to have a good reason to it. People write sob stories, but they are jokes sometimes.
Yeah.
And you have to make it genuine in a sense.
Yeah, I think just being genuine and sincere about your past and about what experiences you can use to make you go into the future and what experiences you're gonna bring to medicine is really just what it's about, and just being genuine. And I think it does take a lot of like self-reflection before you write it, and you can rewrite your personal statement 1,000 times. There's a lot of different ways and tools online to help you like brainstorm ideas and stuff that are helpful, but I think just being sincere, being a sincere applicant is really what it's all about.
Yeah, you have to define why you. Why you? There are so many people out there, why you? Right? So many out there. It has to be a true why you. There are many why yous that just doesn't fly.
Yeah.
So you're talking a bit about how you were in this same spot 6 years ago. Obviously, a lot's changed, but do you feel any different? Like a lot of people think, oh, I'm gonna go through med school and then everything's gonna be good. Or
No, I feel the same. So through medical school or any professional school, once you get there, or even most professions, imposter syndrome is a very, very, very real thing and a very real feeling at every level of training, and no matter how good you get. And I can tell you, sitting there in my first class in medical school, I looked around and I was like, oh shit, like what did I get myself into? Like I scammed my way into here. I don't know what happened. But basically that's how I felt, and that really continues throughout. But like by the end of my second year, I was like, oh, I'm a good medical student. Like I know how to study, I know how to answer questions on tests. Like I was good. Get to my third year, and I'm standing in the hospital. I'm like, okay, like I am not meant to be here. Like I felt it again. And then you get through your third year and you did 12 months of rotations, and you're comfortable talking to nurses. Like the first time you talk to a patient, you like knock on the door and you're like, hi, like are you like awake? Like, you know, like by the end of your third time, you go in, you introduce yourself, you're more confident, and you like can wake a patient up without feeling like you're the worst person on the earth, and things like that. And then sitting in class in Harvard, I'm like, what is going on? I went to community college, like I don't have any like Ivy League background or anything like that. Like this is like my mom, when I told her like I was applying, she's like, okay. Okay. You got it, sweetie. Got it, sitting there. Amazing people, like amazing, incredible people that I have the pleasure of meeting and fortunate to call friends and colleagues now. And then fourth year, you're kind of just like over it. You're just like, I know I'm never gonna feel like I'm ready, but you are ready. So I think you don't really ever feel that comfortable, and I think that's a good thing. I think that means that you're growing and you're learning and you're pushing yourself outside of your comfort limits, and I think that's really, really important in medicine. Because you never want to be, if you're in a room and you think you're the smartest person, or you think you are the best person in the room, first of all, you're probably not. And second of all, you don't want to be in that room because who's pushing you to grow? So I think that's a really, really important thing.
Yeah, was that crazy? Like I was talking to my aunt, and she's like, you're going from like, okay, let's say that you're like, top 10% or whatever in undergrad, and you end up with all the top 10%.
Yeah.
Like, so
yeah.
it's just...
No, exactly. And the thing is, it's so interesting to see, because it really doesn't matter where you come from in the end. I mean, Nova is a smaller private school, and like I was sitting in medical school classes and Harvard classes with people that went to Harvard for undergrad, that went to Duke and Stanford and stuff for undergrad, and they went to private school for high school and stuff like that. And at the end of the day, I'm in the same room, in the same chair, in the same spots as these people. And I don't think your background should define you, but you need to find ways to make yourself stick out. And I think that I honestly think some of my best professors that I've ever had, a couple are here, Dr. Shampat, but two of them,
have to do that.
I would say that two of them were in my community college. Like, they really helped me where I am today, and I really think that they sparked that passion for medicine for me. And I was at community college, Broward College, paid $100 for a class there, like, and that's what sparked my passion and my road to be where I am today, going to Stanford to be an OBGYN. Like, that is basically the ladder that I took, and I really am just so appreciative of those experiences. Like, those are the things that I look back on, and I'm like, wow, I'm really glad that I've had all these diverse backgrounds of experiences.
It's ego. It builds your ego to, when you're sitting right next to a person who went to Harvard, and you've gone through these, and you feel like, oh, Broward Community College and Harvard, I'm better than you.
I would not say that, but
But it does. You have to have that. You have to have that.
Yeah, I
Because
think,
it does put you in that mindset. So it wasn't necessary to have a rich dad to get you there, right? So it did not require this high level performance in a high school to get you there.
But do you feel like you're the unicorn, or do you feel like that's more common now?
You create your own unicorn.
I agree with Dr.
You don't
Shampat.
believe in it.
But you know what I mean? Like, do you feel like that's like you are the 1%, or do you feel like it's more?
No, I
common?
think there's definitely a lot of people like me. I really do. I think especially now I think medical school in general, hopefully, and residency, what we're transitioning away from these just metrics-based admissions processes. That's always gonna play a role.
Yeah.
That's always gonna play a role. That's just
You need a
plain
score,
fact.
yeah.
Because like there needs to be a way to make sure that you're gonna be successful and stuff like that. But
But when there are 4,000 people applying for 150 seats, are they gonna shy away from metrics?
no, that's what I'm saying. It's always gonna play a role, but I do think that they diversified a diversified background. For example, like even in medical school, I will be straightforward with you. I did get really good grades, but I was not in the top 10, top 15%. There's this thing, a society called AOA, which is the Alpha Omega Alpha Society, and that's basically the top 10% of each class. And I wasn't in that. I had good grades. I didn't really have any red flags. Like, I didn't have like a D or a C or anything like that. Mostly A's, a couple, like a lot of B's. Like, and I had really great performance. But I think that I made up for that a lot in like the wards. Like, I worked really, really hard during my clinical years, and I got great letters of recommendation. And like a lot of people like commented on my work ethic and all of these things, and that shone through over my grades. And I think, for example, like step scores, I'm not gonna shout out step scores, but for example, like probably my scores that I got on my board exams are not Ivy League material technically.
And
And I think we're shying away from that, because once you get past a certain point, those aren't saying that you're gonna be a good doctor. What's saying that you're gonna be a good doctor is being a good doctor.
Yeah.
So yeah.
Would you say that passion and discipline in going into the medical field are in a sense interchangeable? Like, you have to have the discipline, like the work ethic, the patience to deal with people, as bad as and crude as that sounds. But you also have to be passionate about what you're doing to show the care and to be interested in it.
So I think those are two very intertwined terms, but I don't necessarily believe they're interchangeable. Just because I don't think a lot of people, but there are people that go into medicine for the wrong reasons, and some of them don't get through medical school, because I think if you're going in for money, you really quickly realize this is not the best way to get money. You can go engineering, you can do IT, you can do many other things. Medicine, for example, like self-selects for people that typically are people interested in helping others. That's kind of the baseline like requirement to be a doctor, I would hope. But I would say that there's also such thing as being too toxic determination, like giving up too much of yourself, which a lot of people do in first year. I definitely did my first year. I course corrected in my second year and gave a lot more kindness to myself. But I think passion, you have to also be passionate about other things and not just grades and things, because those aren't at the end of the day what's important, and it's not the only thing that matters. You need to learn the material because you need to know how to treat your patients to the best of your ability. You just need that. But do I need to know every single antibody for every single disease? For the exam, I do, but in real life, that's going to be available to me on on PubMed or anything. But you need to learn how to be a doctor, which is the important part of medical school, which is learning how to treat patients, how to kind of go through the workflow, knowing where you are in a team. Like, those are really the big things medical school teaches you, because to be honest, you're going to learn how to be a doctor in residency. All of the things in medical school kind of go out your brain, and then you kind of like learn to be what kind of doctor you're going to be in residency and how to actually treat patients. But I would say that they're very close terms, but I think you need to be passionate about other things other than medicine in general, because I think if that's your only passion, that's also not like great.
So then a little side note to that, I don't know if this is necessarily like for everyone, but I'll ask away. On like my application, I wrote out hobbies. Do you think that's like piano, for example?
Oh, 100%.
That's a good thing to
So,
say.
You
Like,
have to be,
Oh,
listen,
100%.
what's more important, and I don't know, I've never been into med schools, I can say, what's most critical to be successful physician is your drive to be happy. If you're gonna be miserable, don't go there. If you're gonna be driven by grades, exams, GPA, bogged down with that, don't go there. It's a miserable place. It's gonna kill you. You have to show why you are there to be happy. And you have to have a method of being happy. Not all intelligent people, not all people who make good grades should be doctors. Just because you're able to make a grade, right, doesn't mean that you're a doctor material. You have to be happy about it.
Yeah,
You
I
have to be
absolutely agree
content.
with that.
And if you don't know how to show that, you lost it. So talking about piano, great. I don't know, I
No, absolutely. So I would say for residency, like literally
Don't
it's
lie about it.
yeah.
Don't make shit up.
Wasn't
Yeah,
planning
yeah,
on it.
yeah, yeah.
That's my point. There is nothing to hide about your niche of happiness.
Yeah.
Always have to be there.
Yeah, I think for especially on applications, super important to show you're a person outside of medicine. And then on the other side, in residency, literally you get like one line of like your hobbies. It's like literally like comma, like what you do. And most of my residency interviews, they're like usually like 20 minutes with 7 different people or 8 different people. Like every single person brings up my hobbies. So like that you need to show what you're passionate about. For sure.
And when you are a nerd, you don't have hobbies. You don't have time for hobbies. You don't create hobbies. You don't think it is necessary to have hobbies. Your job is a 4.0 GPA. You can't afford to have hobbies. As branded into you. And that's not the right way of, that's not the profession you should go in there. It's just
Yeah.
I
mean, you don't have to love everything. You don't. I will say that you don't have to love every subject. I do not love every subject, but like you have to be willing to put in the work, and then like also be okay with not being the best all the time. I think that is actually something that's really important, because more than likely you're not going to be the best person in your medical school class, and that doesn't matter because it shouldn't be a competitive environment. It really should not. And that's something that you should definitely, on the interview trail for medical school or dental school or anything, is get that feel how competitive people are with each other, because you do not want to be in a toxic competitive environment for medical school. I had an amazing class. My colleagues are basically my best friends for the rest of my life. And I'm so grateful that I had them to go through medical school with, because without their support, I wouldn't be here. So, yeah.
You should only compete with yourself, right?
Yeah. Yeah.
So in that MPH program, what is the success rate? How many people apply? How many get in?
I actually don't know the metrics. I
People apply, 15 got in.
I tried to look it up, but there's no, I don't know
Those
what
are
it is.
necessary for your ego.
Yeah, I don't know what it is. Yeah, I have no idea. I was just worried I wasn't gonna get in, so that's why I was looking it up, not because I cared. But
Why did you pick Harvard?
Because they had a concentration in women's gender and health, and a lot of the other schools that I was applying in didn't really have one that's explicitly that. So that's basically why I did that. They also gave me a pretty good
Interesting.
scholarship too.
Interesting that, these days talking about racial bias is a no-no. It's not something that you're supposed to bring up.
Yeah, well,
You're supposed to accept that.
yeah, no, there we very much.
I know that's.
There you
what's
very
spoken.
much
That's
talk.
unusual.
Yeah, yes. So,
Unusual to have.
yeah, no, and I think that's what was important about the work environment is that I was able to be able to talk about those things, discuss critical ideas in all of those things with all of these people from very diverse backgrounds. That's what made it so awesome. Like to talk about these things that are really hard to talk about in public, which is awesome. So.
It's a taboo.
Yeah, but it's something that we need to talk about, and it's something that we have to do work on, and that's why I did my work in that. I published a paper in the Harvard Public Health Review on racial disparities in maternal mortality. If anybody wants to look that up, it's in there.
That's a rarity, right? Such publications are rarity, not a common thing that.
So I think that it just depends if you want
If
to
you
publish
did
your
work.
work. Yeah, so like you write your term paper, and then I just happen to submit it to a journal and to the journal, and then do all the revisions when I get the critiques back.
Peer-reviewed?
Yeah, it's peer reviewed. But that is something if anybody wants to look it up. It's a fun paper.
Well, when you're in a medicine, you have rare chances of almost never, unless you do research and do this kind of stuff. You don't have a publication.
Yeah, so I think it is hard to publish in medical school. People do it, and I think it's really important to have good research mentors
Correct.
that help you do that. That is that was my only technical, like, real publication at the time, and I wrote a textbook chapter during medical school as an elective. So those were my two publications when I applied for residency. But all my other ones were poster presentations. Poster presentations are very common in medical
Yeah,
school.
that's
The peer-reviewed stuff is a little bit more.
once you start practicing, chances of writing any scholarly article is out of the door.
Well,
Unless
if
you
you're
do
unless you do like a academic, if you're in an
Yes.
academic hospital,
Academic
yeah,
research is
yeah.
very
Yeah.
difficult to do
yeah. So it just
when you
depends.
have to pay back loans.
Quickly doubling back, as far as competitiveness, do you think, like, I don't know, like, where you applied or what you're thinking, but do you think pass-fail versus grading scale influence, like, within your medical school?
So I didn't let it influence me because I got accepted to programs that did both. The only thing I would say with that, I think it didn't really make a big difference because a lot of places, if it's pass-fail, it's like high pass, pass, and fail.
Right.
Which at the end of the day, it's A, B, and C because that's all there is in medical school. There's no D and F because then you're failed. So, like, it's the same. So it kind of comes out to the base thing. And then you have to, for residency, they put you in a quartile. So they have scores somewhere to be able to rank you somehow. So it doesn't. I don't think it really matters that much.
It's the same thing.
Yeah.
See the fail.
Yeah.
Yeah, I don't think it matters that much. But like, if that's something that's really important to you, then I would take into consideration.
Alright, well, thank you everyone for coming. Thank you,
We got
Evan. This is
time.
great.
Yeah.
We have to get out of here.
Yeah,
Kevin,
for
thank
sure,
you.
for sure. You're welcome. And if anybody, I can give Dr. Shambag my email if anybody has questions. You guys can ask him for my email.
Very good.
So,
Thank you so much.
yeah, of course. It was nice to meet you.